All right. Well, thank you so much for joining me today. Excited to share with you just how we approach cancer care here at Valley Vital Medicine. It is one of the things that I would say that we fairly consistently get phone calls about. People have a lot of questions about what kind of options are out there for cancer care. And so we're going to talk about that a little bit today. But I love being able to be positive because frankly, your body has more power, and your God gave us the ability to be able to heal and recover in really powerful and amazing ways. Our journey that each of us is on is different, right? But most people think that cancer is a battle that's fought with surgery, chemo, and radiation. But there are so many more tools out there that are available. And frankly, how we live our life and our mindset makes a really, really big difference in our outcome with cancer. So if we can give the body the nutrients that it needs to be able to fight back, that's really crucially important. And you know what? There's some really amazing, powerful, super tools that we can use. So my goal is by the end of this webinar, you're going to learn ways to proactively help support your body and prevent and resist cancers. And even we're going to talk about a really great screening option as well for those of you who maybe have never had cancer, you're worried if you have cancer, or perhaps you're in remission and you want to do some additional testing to verify that you are still in remission. So let's go ahead and get started, and we'll go from there. All right. So this webinar is for informational purposes only. The information provided in this webinar is for educational informational purposes, is not intended as medical advice. The content shared is not a substitute for professional medical care. Always seek the advice of a qualified healthcare provider with any questions you may have regarding a medical condition or treatment options. Valley Vital Medicine and myself do not diagnose, treat, or prescribe for any specific health condition through this webinar. Any protocols, supplements, or treatments discussed should be considered in consultation with your healthcare provider to determine what is appropriate for your individual needs. Participation in this webinar does not establish a patient-provider relationship. By attending here on this webinar, you acknowledge and agree that you are responsible for your own health decisions. Valley Vital Medicine and its presenters are not liable for any direct or indirect consequences resulting from the use of the information provided. All right, got that out of the way. So I would like to tell you, you're in the right place today if you have or have had cancer, or perhaps you're worried about getting cancer, or you've had cancer and you want to stay in remission. You want to talk about or learn about advanced screening options. You're undergoing cancer therapies currently, and you want to support your body with some additional natural means. But also, if you're curious about alternative therapies, high-dose vitamin C, ozone therapy, powerful nutrients, things like alpha-lipoic acid, methylene blue. We're going to talk a little bit about ivermectin and fenbendazole and mebendazole and those kinds of things. And some of these options that we're going to talk about are really cutting-edge therapies and strategies that most doctors, especially in the conventional medicine world, just frankly aren't very familiar with. So we're going to talk a little bit about each of these things and what kind of some of the science of the research behind them says. Now, I do like to lead with this statement because I don't like to pretend to be something that I'm not. Okay, I'm not a cancer expert. So in other words, I mentioned this to every client that comes to me and that we do a consultation who has cancer is asking for our opinion and help with their care. So we're not cancer experts. I'm not a cancer expert. This webinar today is not all-inclusive of all of the tools available, nor am I presenting all of the options available for anyone in the care of cancer. We're here to partner with you in your health and wellness journey and work to optimize and improve the body's function so ultimately you can live your best, healthiest life. Okay. So what I mean is by we're not cancer experts. So what that means is if you come to us with a particular type of cancer and you say, is this radiation? Is this surgery? Is this chemotherapy right for me? I won't be able to adequately give you that answer, okay? Because I don't have the oncology background, okay? However, I do have a significant background in learning about how the body works, what predisposes us and makes us more likely to have imbalances, makes us more likely to have issues where our body gets out of control, cancer cells start to thrive and to grow. And so if we support the body or help to figure out where the breakdown is, that oftentimes will give us the answer as to what we can do to best get our body to function the way that it's supposed to and resist disease and cancer. So I'm Trevor Halsauer. I'm a family nurse practitioner. Started Valley Vital Medicine here in 2019. So this coming summer will be 6 years already. I am certified through the Institute for Functional Medicine, and we've been doing IV vitamin therapies in our practice for about the last 5 years or so, and seeing some really cool, amazing results. As I started doing that, I had people that would reach out and say, hey, can you do high dose vitamin C IVs? And as I kind of looked at that a little bit more, I said, I'm not totally familiar with what that means or how to do it safely, and I'm not very comfortable with it. And so what I decided I needed to do is I need to figure out who really is at the forefront of high dose vitamin C therapy, go and learn from them. And so what I did several years ago is I did travel down to Wichita, Kansas, and spent some time with the providers down at Reardon Clinic. Okay, Reardon Clinic is responsible for the vast majority of vitamin C research that's been done in the last 50 years. And so by spending several days with them, learning their protocols on how they were treating their clients, I learned a vast amount and came back and started instituting and utilizing their protocols. Now, if you look up Reardon Clinic's website, they have a whole slew of information on the research that they've done, the benefits of high dose vitamin C. So I encourage you to check that out. Okay, here we go. So who are we? So this is our mission statement. So we ignite hope, deliver healing, and provide education that empowers individuals to optimize their health and confidently live out their God-given purpose with vitality. This is why we're here. This is our team, or at least part of our team here at Valley Vital Medicine. So very, very privileged to have these ladies as a part of our team. Right now, I'm the only man on staff, so these ladies are absolutely amazing. They help keep me in check and keep me going in the right direction. And so it's just super grateful for them. We do have a couple of members of our team that are not currently on this picture, so we need to get this updated for this summer. But so grateful. I want to give these ladies props as far as the things that they do and how they care for our clients here. Let's see here. Also, I wanted to mention, I've also learned under Dr. Frank Schellenberger in regard to ozone therapy, high dose vitamin C, and Dr. Thomas Levy. Dr. Thomas Levy is an incredible mind in regard to the benefits of high dose vitamin C, but also methylene blue in regards to general overall health, and also as it's utilized in cancer therapies. Really, I would say I have an insatiable appetite for learning. I work constantly to do what I can to improve our patient outcomes. And so, I'm going to be presenting the greatest and newest information that I currently have. But likely, if you ask me in a month or two about the information that I'm giving out in this webinar, it may have changed just because of some of the newer research that's come out or some of the most recent education that I've done. So keep those things in mind for me too, because frankly, we do have a fair number of cancer clients that come into our practice actually on a daily basis. And some of those clients, I'm going to be sending them this information because some of this is new since they started doing therapies with us. And so want to get everything kind of compiled, put together, and streamlined so that everybody's on the same page. This article that came out this last fall was something that I was super, super, super excited to see. Because frankly, prior to this article that came out, there was a lot of confusion about some of these alternative medications that can be used in regard to cancer care. And I will send, as a part of the follow-up from this webinar, when I send out the email, I will attach this article to that email so that you can review it. This article was in the Journal of Orthomolecular Medicine, and they published an article called Targeting the Mitochondrial Stem Cell Connection in Cancer Treatment. And in this article, they talked about the benefits of fasting, ketogenic diets, exercise, hyperbaric oxygen therapy, ivermectin, benzimidols, and DON. So things, what that means is fenbendazole, mebendazole, ketogenic diets, vitamin K2, vitamin D, zinc, vitamin E, CoQ10, methylene blue, niacinamide, riboflavin, artemisinin, melatonin, and magnesium. These things are all really crucial in cancer care. And so what is really, really amazing, and what I loved about this this article, and again, you can review it for yourself, but I pull out this article and I review it with clients when they come in, because it actually gives recommended dosing for each of these things based off of the most recent research. And so, I had clients coming to me pretty regularly, for their cancer care that had been taking ivermectin or fenbendazole and asking about dosing and those kinds of things. And frankly, I'd spent time trying to look through the research and those kinds of things and be able to differentiate, figure out what the dosing for these different things was. And it was really, really hard to figure out. And so love this article because the doctors that did this really did their homework. They dug in, they were able to give us exact dosing. And so I'm so grateful for them for doing that for us. Now, as I mentioned originally, I'm not a cancer expert, right? And so I encourage clients when they come to us to establish care, and we can certainly start doing some things to help to optimize, improve health, work on high-dose vitamin C, ozone, some of the ivermectin, fenbendazole, and all that kind of stuff. However, I do encourage people to consider working with somebody who does specialize in cancer care. And so this list that I have right here is a list of people down in Mexico, but also locally here in the US that I do recommend that people contact, interview, see if they are a good next best fit for them in being able to help them along their cancer journey. Oftentimes what a lot of people will do is they will travel to one of these places and they will stay there for a couple of weeks or so, do some really intensive therapies, and learn how to eat, how to work through some of their emotions that potentially, they have a history of trauma or abuse or something along those lines that are coming to fruition through their cancer as well. And so those things also need to be worked on. So by going either to a destination or, if you want to work virtually, some of these places do that as well. Again, this is something that I talk about with each of our clients, give them the contact information and recommend that they reach out and see if one of these places is right for them. They can give more pointed direction. And also, I don't have any specialty in utilization of mistletoe, but these other places do. And so they can give additional recommendations as far as whether that's right for them, utilization of those types of therapies. Also, I recommend that people do their own homework. There are many books that I recommend actually, so that people can learn, and you are your own best advocate. And so the more that you know, the more you're going to be able to know what your body needs, and also be able to take care of yourself, because nobody's going to take care of you. Nobody's going to advocate for you like you will for yourself. So I encourage you to do your own education. And so these 4 books I have found to be quite impactful. So there's a book, Any Way You Can, by Dr. Annette Bosworth. She has a book that goes along with it called Keto Continuum, really talks through how to utilize a ketogenic and a really clean diet in fighting cancer. But the Any Way You Can is really about fighting cancer in any way that you can. Right? Because a lot of times what we want to do is we want to throw the kitchen sink at this thing. We want to use every tool absolutely available to be able to get our body to function at its absolute best. Curing the Incurable by Dr. Thomas Levy. Again, I did some education and training under him. This is about the benefits of vitamin C, and it's all about the research of vitamin C, and kind of putting some of the naysayers to side, because frankly, the case is really strong as far as the benefits. Supercharge Your Health with PEMF therapy. Dr. William Pollack, he is a forefront man as far as having knowledge in regard to the benefits of PEMF therapy. The Cancer Revolution, a groundbreaking program to reverse and prevent cancer by Dr. late Aaron Connolly. That's a great book as well. The Metabolic Approach to Cancer by Dr. Nasha Winters. Hidden Epidemic by Dr. Thomas Levy. Hidden Epidemic is something that I think is not well known enough. That book, Hidden Epidemic, is actually all about dental, okay? Hidden infections in the mouth. His point is, if there's hidden infections in the mouth, if there's teeth that have been removed and there's cavitations or infection in the jaw, or a root canal that is present, that those things have a chronic infection associated with them. There is a lot of science and evidence actually that there's a direct correlation with cancer and cardiovascular disease with these silent oral infections. So I encourage you, if you have a oral infection, if you have a tooth that's bothering you, if you've had a root canal, we should explore having that removed. The Ozone Miracle by Dr. Frank Schellenberger. Again, I've done a lot of my education underneath him. All right. So why does this matter to me? I've seen firsthand how the right approach can absolutely change lives. I have an uncle that I grew up really close to. Is my Uncle Roger. He had pancreatic cancer. He didn't live local to me. He was from out in Michigan, but we used to go out and visit him for a month every summer when I was growing up. And unfortunately, because of the distance between us and him, and he didn't have nearly the tools available that I had here, I was not able to help him as much as I would have loved to. Also know he had an incredible sweet tooth. And one of the things that I definitely talk to my clients about is the fact that, we need to clean up our diet, right? So unfortunately, he did pass away from his pancreatic cancer. But we have several clients here who have been coming to us for quite a while for some of their high dose vitamin C and some of their cancer supporting therapies, and they have done really, really well, really amazing. But some people come to us after exhausting every conventional option, right? They're tired, scared, they're looking for something or anything that can give them hope. Because frankly, I think if the conventional medicine system is really good at doing anything, it's often really good at knocking down hope and not leaving people feel like there's anything that they can do. But others, so a lot of times our clients will choose to be proactive. They come to us sooner and they get started with high dose vitamin C, supportive therapies. Oftentimes we can see a really amazing change in them. Their labs are improving, they feel alive again. And frankly, when I see those things, that's what makes me be here today and makes me say, hey, you know what, this is real. People need to know about this stuff. So what you see here is a beautiful young lady, and we had a testimonial article that was done, and you can see there's stories of transformation at Valley Vital Medicine and trendsetters. This is an article that was done, and Sharon was gracious enough to come in and be interviewed for this. And so I'm just going to read her article super quick. And so what it says is Sharon Odegaard, who's 75, started coming to Valley Vital Medicine in September. She decided to come after talking to her mom's friend from Dickinson, who's 95 years old and loves the clinic. Sharon was already set up to start chemotherapy for cancer, but her mom's friend suggested she check us out for care to help with her chemo side effects and symptoms. She says, I talked to Trevor. They had a good plan for what I needed. It's been wonderful. I've had no side effects from the chemo, Sharon said. I had this same cancer, 35 years old, and back then I had a lot of nausea. I used to feel really sick, especially driving home after treatments, but this time I don't even feel like I'm going through treatment. It's been a completely different experience. I tell people this is the way to go. People can't believe it. They ask, how are you doing? And I say, fine. I don't even feel like I'm going through treatment. I even told my oncologist, if people want something else and want to feel better, this is what they need. I just feel so good. I lost my hair. That's the one thing. But other than that, I haven't had any issues. My doctor asked if I needed a refill on my nausea pills, and I said, I haven't even taken one. I had chemo yesterday, and I feel just fine today. It's incredible. This treatment plan here has made all the difference. I've had Ozone once a week, vitamin C twice a week, and I use the PEMF mat. Sharon should know that the treatments are making a difference, as she's had cancer 3 times. First, it was non-Hodgkin's lymphoma 35 years ago. Then after I retired, I had breast cancer about 7 or 8 years ago. And now this. At first, I was feeling really tired and unwell, and they were running tests. They thought it might be sarcoidosis because of something in my lungs, but they decided to check my abdomen with a CT scan, and that's when they found the mass on my liver. It turned out to be a cancer all along, but no one was expecting that. I'm just thankful they found it when they did. My doctor was shocked that the same cancer came back after 35 years. He thought I was cured, but they say lymphoma is one of the most treatable cancers, and so I'm grateful for that. Sharon remembers how bad she felt during her past treatments. I remember that first week after treatment, I'd sleep my weekend away. The meds, especially the ones for nausea, just made me so tired. Then the next week I went to work because I just started a new job and didn't want to use too much time off since I didn't know what the future held. But I had brain fog. I somehow got through the week, and by the time I started feeling okay, it was time for another treatment. With a support plan at Valley Vital Medicine, it's completely different. Love this story. She's an amazing woman. We're so grateful she's here and grateful for the experience that she had and the benefits that she has seen. Cancer is probably one of the most scary words that's out there. And our current situation, frankly, is sad and it is scary. The current statistics from the American Cancer Society state that 1 in 2 men, 1 in 3 women, and 4 out of 10 people will develop cancer of some type during their lifetime. Why? What is causing this crazy epidemic? Frankly, I think that it's because, number one, we live in a crazy, stressful world these days. Many people have dental concerns that they're not aware of as being a potential problem. Toxins, I think, are a significant issue. Molds, herbicides, pesticides, heavy metals. There's a lot of evidence of correlation with parasites and cancers as well. Vaccines, bad water. Bad water. You guys, if you're drinking tap water, you gotta stop. Drink distilled water. Get yourself clean water so that way you're not giving yourselves a dose of toxins every time you drink water all day, every day. Okay, we got to switch it up. We got to get clean. We got to get rid of the toxins so that our body has the ability to heal in amazing and important ways. Your body is really resilient. We can supercharge our body's ability to fight back, but we have to give it the right support. We have to be able to figure out what it is that is causing the imbalances, that is making us toxic, that is making us sick, that is causing imbalance in our blood sugars. And we need to strengthen, we need to fuel our body. in powerful ways. We can utilize therapies like high-dose vitamin C, ozone, targeted nutrients. So we're going to talk about that here in a second. But first, I want to talk about just some of the basics. Because these lifestyle considerations, if they are not being utilized, we can throw all the rest of this stuff at you when you have cancer. But if somebody going through cancer, and frankly, any of us who's healthy on a day-to-day basis, if we're not doing these things correctly, it's going to set us back, and it's going to make it a lot harder for us to make the improvements that we're trying to make. Diet, number one. Our diet in America stinks. They call it the sad diet for a reason, right? Standard American diet. And we have too many carbohydrates. We have too many processed foods. We have enriched foods that have folic acid in them instead of folate, and frankly disrupt the ability for a lot of us to make our own energy. Excuse me. But also, we eat way too much sugar. We eat too much too often of foods that are not nutrient dense. They don't serve us in any sort of beneficial way. So the first thing that I talk to clients about when they come in with these concerns is their diet. Tell them, hey, you know what? We got to get your diet cleaned up. We got to get rid of sugar. We got to get rid of processed foods. We need to be eating a whole food diet, and generally, ideally, more of a ketogenic diet, one that has really almost no carbohydrate in it at all, because cancer generally loves sugar. We got to get rid of it. It's important for us to exercise. There's many medical articles and research that have been done that prove that people who are exercising are going to live healthier, longer, and do better as they get through their chemotherapy, their radiation, their cancer treatments, whatever it is they decide to do. If you're not exercising, you are not going to be getting the full benefits of those therapies, but you're also not going to be as likely to heal. Water. I just mentioned that a minute ago. Getting clean water is crucially important. When I talk to clients here in our office about toxins all the time. And analogy that I like to use is we all have a bucket. And that bucket starts filling. And it starts filling with toxins, starts filling with a bad diet, starts filling with traumas and abuse and all those kinds of things in our past. And if we don't have a way of opening up the spigot on the bottom and letting some of those toxins out, eventually those toxins build up to a point where the bucket starts overflowing. And that's when we start really experiencing a lot of symptoms. And those symptoms can be different in everybody. So it can be different from somebody that has a cancer versus somebody who has an autoimmune condition, or whatever other illness that it is that somebody is struggling with. So what we have to do is we need to figure out a way to slow down the amount of toxins that are being put into the bucket, because if the bucket is filling up faster than what we can empty it, we're never going to make the progress that we need to. And so water is one of those things where I have seen people go through detoxification reactions from just getting clean water, because now their body is not dealing with the toxins that they're drinking all day, every day. And instead they get good, clean water, and they're able to start getting rid of things. And like I say, my preferred source of water is distilled water. Stress, trauma, abuse, daily stress. If we're not managing this in a good way, this breaks down our body's immune system and puts us at a higher risk for any chronic disease, but also cancer as well. And there are cancers that have been able to be directly correlated with, again, like I say, trauma, abuse, and those kinds of things. Genetics. So genetics are important. We do a genetic test here in the office called 3x4 that gives us an idea if somebody's at a higher risk for their ability to make energy with methylation defects. We also look at, are you more likely to have a higher need of vitamin C or a higher need of vitamin D? And we can tell that stuff by the genetics. Now, I will tell you though, genetics load the gun, but our environment, the things that we're exposed to every day, pulls the trigger. So just because we have genetics that predispose us to a certain way of life or condition, that doesn't mean that that's something that we're stuck with for the rest of our life. So it is important that we keep these things in mind, but it's also important that we realize that how we live our life can change how our genetics are seen in our life. Okay. All right. So let's talk about tools that we have here at Valley Vital Medicine. And there's a lot of them. And there's things that we can do that are really, really powerful. And frankly, I think pretty cutting edge, because some of these things are not widely available. I would encourage you, if you have cancer, or when somebody's diagnosed with cancer, or if you're in remission, we really have to do some introspective thinking and think about how aggressively do we want to approach this? Because that matters. If we don't take full advantage of the tools that are available to us, it takes really being quite intensive in therapy, especially in that initial time frame. If we don't do enough, the likelihood that we're going to be able to make the gains that we're hoping to make is not very good. Okay, so a lot of people, what we'll want to do is we will, in a way, want to throw the kitchen sink at this, and we'll want to go in and do as much as we possibly can. And I know that this is challenging, and frankly, it's so this is where we just need to sit down, have a conversation, go through your current situation, actually do some lab work. Okay. So what you'll see here and on this first slide here, where we're talking about oral supplements, things like vitamin D, zinc, vitamin C, we can actually measure the levels in your body of these different substances. And if it's not at an optimal level, then again, we're not being aggressive enough to try to get these things knocked down. Okay. Vitamin D, in my opinion, this should be around 100 for anybody who has cancer. Vitamin C, we'll talk about how we do this in a minute, but we measure vitamin C levels in the blood. Zinc should be 80 to 120. And this information, again, is based on that research article that we talked about from Orthomolecular Medicine. Ganoderma spores. So Ganoderma is a medicinal mushroom, really, really powerful anti-inflammatory and anti-cancer properties. And, look at, for any of these things, you can go to PubMed. So PubMed is a place where research is kept and published and housed, where you can go in, and it's free for the general public, and you can just type in any of these conditions or any of these products in cancer, and it will bring up all of the different research. And I don't have time to put all of the research together and talk about each of these things in depth at this time, but there's a lot of it. Melatonin. Most people don't realize that there's no such thing as a toxic dose of melatonin. So I actually encourage cancer clients to consider taking 100 milligrams, 200 milligrams, 2-3 times a day to have anti-inflammatory properties, and those doses have been shown to help in cancer. Okay, methylene blue. Methylene blue, we'll talk a little bit more in a minute. It can be utilized orally as well as IV. Omega-3s, so think about your fish oils. This can be measured as well, and we measure this level in all of our clients, and so I recommend that gets measured. Berberine. Berberine is an herb that helps to balance out blood sugars, reduce inflammation as well, and can have some additional cancer benefits. There's a lot more than this, okay? But these are the top ones that I recommend that really need to be included in your care while you're going through all of these things. So that way, we're taking advantage of that. Okay. Oral prescriptions to think about. So these get ordered through a compounding pharmacy. We have one in Fargo. There's some out in Dickinson, out in Bismarck, because these need to get dosed specifically and directly for you. How I dose these things is dependent on the significance of your cancer, but also again on that article through from that was published in Orthomolecular Medicine, because it gave very specific very specific dosing instructions. So ivermectin in a low-grade cancer, according to that article, is recommended at 0.5 milligrams per kilo. So it's dosed based off of weight in 3 days a week. And then for a more advanced cancer, it's that 0.5 milligrams per kilo every day. And then for a more advanced or aggressive cancer, it goes up to 1 milligram per kilogram. And so some of these doses do get to be quite high. Mebendazole and fenbendazole. Fenbendazole is available online. So you just have to do your research a little bit and look at figuring that out. And then mebendazole, in some cases, what I'm seeing is that mebendazole is considered to be more effective than fenbendazole. And so, again, the dosing for these things, I follow what was published in that research article. And so I do send these things over to the compounding pharmacy for our clients to make sure that these things are covered and that they're dosed correctly. So the research on these different things, again, is within that research article. Mental health and trauma. I encourage our cancer clients to strongly think about doing counseling, because oftentimes there's a lot to work on and work through. Neurofeedback is something that we do offer here in the office. I love it because frankly, it's really amazing and has amazing great benefits for a lot of our clients. And so the type of neurofeedback that we have is called IASIS neurofeedback. You can find more information about this on our website. But what it does is it helps to untrain the brain out of its stress, fight, or flight response by utilizing a microdose of electricity, a millionth of what's in a cell phone, to work on the delta waves in the brain. So that delta wave is responsible for sleep, but stress, fight, or flight. And so what people oftentimes found is that they're able to work through their emotions. They're able to work through their counseling, work through their traumas and abuse, and their anxiety, uncertainty about life, just overall improve brain function. And IASIS neurofeedback is one of those things that I strongly, highly recommend for our cancer clients, but also anybody else who is struggling with any of those concerns or just brain optimization. All right, vitamin C. So I would say that vitamin C is our flagship. We do a lot of high-dose vitamin C here. Now, the dose of vitamin C, or what is the definition of vitamin C, or of high-dose vitamin C? That depends on who you talk to a little bit, right? So I've had clients that come to us from other organizations here in town or other places, and they are told that 15 grams of vitamin C is a high dose, which is 15,000 milligrams. I would argue to you that that's not high dose vitamin C. High dose vitamin C, per definition of the education that I've done, is anything that's 25 grams or 25,000 milligrams or greater. Now, what I would tell you is that that level of vitamin C therapy is not enough. It's enough to help a little bit, maybe with some side effects, help a little bit with taking care of some of the oxidation that somebody might experience during their cancer therapies. However, our cancer clients in general are doing anywhere from 75 grams up to 150 grams at a time. And the highest dose that we've done at this point in our clinic is 300 grams or 300,000 milligrams of vitamin C in one day. So what I will tell you about vitamin C is that it's very easy to underdo, but it's impossible to overdo. So based on research and what's been done is that there has been no found dose that is toxic to the human body when it comes to vitamin C. So when I mentioned to you earlier that I traveled down to Reardon Clinic to learn their vitamin C protocols, that's what I brought back, and that's what I started instituting. And now I've done some additional education and just finished this up actually in the last few weeks through a company called VCICI, Vitamin C Institute. And so really getting up to date on the most recent research on the benefits of vitamin C and utilization of it in the clinic. Okay, so frequency of therapy and what we do here really is going to vary depending on what your goals are. Are we utilizing this alongside of your conventional chemotherapies? If we are, I encourage you to talk to your oncologist and make sure that they're on the same page and that they are willing to work with you while you're utilizing these therapies. If they're not, couple options. Number one, you can look for a different oncologist, or potentially we need to just wait to work on the things that we're working on until after you're done with your chemotherapy, radiation, those types of things. And then we can work on putting you back together and detoxing you at that time. Okay. It's just too much of a risk in general with the license and the things that we're doing. If there's an oncologist that is blatantly against us and they find out what you're doing and they completely disagree. So that's just a conversation that we would need to have as a part of this. So what is the Reardon protocol? So what we will do is, and oftentimes we can start this on the same day as somebody comes in for their first initial consult, is we will do their first vitamin C IV. And it's one that we call our natural defense. So what's in there? It's about 15 grams of vitamin C, and we draw some lab as a part of that. Okay, so one of the lab that we're looking at is called a G6PD. So if somebody has a deficiency of G6PD, and it's fairly rare, but they are actually at a higher risk for hemolysis or bursting of their blood cells if we put their cells under an oxidative stress. So one of the reasons that high dose vitamin C works is because it's an oxidative therapy. So in other words, it causes stress on the body. Okay, so I think about like exercise. And so if we exercise the body, it breaks it down a little bit, which makes it stronger. And so that's what oxidative therapies do to the immune system, but also cancers have a higher sensitivity to oxidation, which makes them more prone or more likely to be killed by oxidative stress. Okay. So after that first dose of 15 grams, that next we will do a 25-gram dose. Generally, it'll go the next day, and then we can do a 50-gram dose the following day. Now, from there, we do a 75-gram dose. After we do 75 grams or 75,000 milligram IV, we measure your ascorbic acid level within 10 minutes after that IV gets done, so that way we can see what the ascorbate level is in your blood. So we want it to be between 350 to 450 nanograms per deciliter. If it's not high enough, we have not reached the threshold at which the vitamin C has been found to be toxic to cancer cells. So again, if your blood level comes back at 270, 300, we'll say, no, you know what, we need to go up to 100 grams at your next IV, and then recheck your ascorbate level again after that. And we'll continue until we get to that threshold, somewhere between 350 to 450 nanograms per deciliter. So what's a normal range? Somewhere between 75. Most people, I would say that's probably going to be more for a smaller individual. Most people are going to land somewhere between 100 to 150 grams of vitamin C in an IV to get to that level. Okay. Also, what we need to do is there is a product. Is this going to work? It's called Pure C. Pure C, SNC. This is powdered. This is powdered ascorbic, sodium ascorbate. Sorry. While you're undergoing your vitamin C IV therapies, you need to maintain the vitamin C level in your blood. And the way that we do that is by putting some of the vitamin C powder into your water bottle, and we do what's called the SIP 7 to 7 protocol. And so what that means is from the time you get up until the time you go to bed, we'll have you put 2 scoops of vitamin C into your water bottle and sip on it throughout the day. So every half hour, and take a drink, you'll want to take a sip of vitamin C to help keep the level in your blood up high enough. So that way, the next time that you come in and get your next vitamin C IV, it's not nearly as hard to get your vitamin C levels up high enough. Now, you don't need to do the oral vitamin C on the days that you're coming in and you're doing your IV vitamin C. So the days that you have off, then you will want to utilize that powder, okay? So what has vitamin C been shown to do? So cancer cells are susceptible to vitamin C due to their abnormal blood flow and reduced levels of antioxidant enzymes. At high doses, vitamin C acts as an oxidant. So again, generally, I know I said 25, but generally for sure 50 grams and higher, but that's still not high enough for cancer care, okay? It enhances cytotoxic effects of radiotherapy and chemotherapy by increasing oxidative damage to the cancer cells. So in other words, what that means is it's making radiation and chemotherapy more effective. It mitigates normal tissue damage during chemotherapy and radiation. So in other words, it's protecting healthy cells. So it demonstrates cytotoxic effects across cancer types, including esophageal, gastric, non-small cell lung, glioblastoma, and pancreatic cancers. What you see next to that statement, excuse me, is PMID. So what that means is PubMed ID. So what you can do is you can take that number, you can plug that into PubMed, and it will bring up that research article that talks about that, okay? So initial studies have identified that at least 30% of patients with advanced cancer have plasma vitamin C deficiency, correlating with shorter survival times. I would argue that likely everybody who has cancer, anybody who has significant amount of stress, anybody who is a smoker, we likely have deficient vitamin C levels, okay? High dose IVC showed symptom benefit, including improved quality of life and reduction in sleep disturbances. A very recent study on glioblastoma, this was just here in 2024, showed that HDI, high dose vitamin C, was shown to induce significant cell death in glioblastoma cells. High dose IVC was shown to induce apoptosis in tumor cells. So in other words, it caused the cells to burst and to die. Inhibit angiogenesis. So in other words, they were not able to build up their own blood levels or their own blood supply like they want to, and also help to reduce inflammation. So IVC selectively accumulates peroxide at high doses, okay? So what that means is, so you've heard of hydrogen peroxide, H2O2. That is a byproduct of high dose vitamin C, which is only achievable through IV administration. So that's one thing that people sometimes will ask is like, well, can I just take a whole bunch of vitamin C by mouth? You cannot, it is not physiologically possible for you to reach the 350 to 450 nanograms per deciliter that we're looking for in this case with oral use of vitamin C. It's not possible, okay? Our guts just aren't good enough at being able to synthesize and utilize and be able to get that absorbed into the body, okay? IVC selectively accumulates peroxide at high doses, achievable only through IV administration, inducing, excuse me, oxidative stress in cancer cells similar to chemotherapy, but it spares healthy cells. And this was some research that was done by Reardon Clinic where I went and studied with them. 2024 study, again, very recent, showed that redox active vitamin C triggers reactive oxygen species, iron, calcium signaling in osteosarcoma. So in other words, this is just a mechanism at which the vitamin C is working to reduce ATP production, so to reduce energy production in cancer cells It impaired cancer metabolism, which highlighted its potential in aggressive cancers. In vivo results showed significant tumor growth reduction in osteosarcoma xenografts. So it's just a different type of cell that they were studying vitamin C against. Okay. Findings indicate that cancer cells' elevated oxidative stress and iron levels make them more susceptible to the pro-oxidant effects of high-dose vitamin C. So again, kind of the same thing we've been saying. Clinical trials have highlighted some outcomes in tumor response rates and decreased progression in cancer cells, especially when it's been done, or when it can be done in conjunction with conventional therapies. Okay. The selective nature of high-dose vitamin C offers potential for synergistic use alongside traditional therapies. What you decide to do in regard to pursuing chemotherapy, radiation, surgery, ultimately is up to you. We can utilize these things alongside those therapies. And it's very safe. I would just say we just need to do it on a different day. Okay. But again, this is something to be considered in more of a specific consult. So patients with advanced cancer may benefit from high-dose vitamin C therapy as part of an integrative approach, providing both direct and cytotoxic effects on the cancer cells. Okay. So how we determine your dose. So we already talked about the Reardon Clinic protocol and kind of how that goes. It is optimal to be more aggressive for 1 to 4 months, which depends on the significance of the cancer. What does aggressive mean? More recent research shows, and the recommendation is, especially in regard to the recommendations on the training that I just took through VCICI, 3 to 5 times a week to be sitting in an IV chair and getting high-dose vitamin C. The more you can do, the better. Okay. As I mentioned earlier, it is easy to underdo vitamin C therapy, and it's impossible to overdo it. So we follow the Reardon Clinic protocol. We get you up to the dose where you are following your ascorbate levels between 350 to 450 nanograms per deciliter. Once we're there, we stay at that dose. Unless you request to go higher, we certainly can do that and just go do longer IVs. But we titrate your dose until we're at that therapeutic level, and then recommend that we do that 3 to 5 times a week while maintaining your vitamin C levels using the pure CSNC sodium ascorbate in between your therapies. Okay. Other IVs that can be beneficial, so we can stack these. So if we are going to do ALA, CBD IVs, methylene blue, they are done after vitamin C. Okay. So what are some of the benefits of these? Alpha lipoic acid has been shown to be a powerful antioxidant. It also helps to keep the vitamin C levels in the blood a little bit higher. Okay, it's anti-inflammatory, supports mitochondrial function, potentially inhibits tumor cells, regulates glucose, and has neuroprotective effects. CBD, we now have, starting on Thursday this week, and I'm really excited about this because this is a brand new thing that we're instituting in our clinic. The research on CBD is really significant, but I found that a lot of people that utilize CBD orally just don't get the results that they would expect to get. We have the ability now to do CBD in an IV form. So research on cannabinoids have been shown to have various anti-tumor effects, chemosensitization, reduced side effects of conventional therapies, inhibition of metastasis, improvement of quality of life, in that it helps with pain relief, nausea, vomiting, anxiety, depression, sleep, and appetite stimulation. Pretty cool stuff. So I'm excited to be able to start kind of offering this along with the vitamin C therapies. Methylene blue. Methylene blue has great effects on metabolism, balances the redox, or in other words, that oxidative balance, and can create a greater oxidant load in the cancer cells, and can have neuroprotective and cognitive benefits, as well as potential anti-tumor properties. Ozone therapy. Love ozone therapy. We do this all the time, every day in our practice. We have several different options. So the reason that this is a part of the cancer protocols that I like to utilize is because ozone is another oxidant therapy. Okay, so it's very synergistic, works directly alongside of vitamin C. And so if we are going to stack, and what a lot of our current clients will come in and do, they will come in and they will do an ozone therapy and follow that ozone therapy with vitamin C. Ozone always comes first. We don't do vitamin C and then ozone, just based off of the experience of the people who teach and educate and research. That's the best and the right way of doing it. So major out of chemotherapy is a smaller dose oxidative therapy. We treat about 60 milliliters of blood. We always start there with people, make sure that they tolerate, they do well with that therapy. We titrate up to a high dose ozone, treats about 300 milliliters of blood. And then EBOO treats about 2 liters of blood. And this picture here that you're looking at is myself doing an EBOO therapy. And you can see there on that bottom picture, the difference in the coloration of the blood between that dark blood that's coming out of my body after it goes through the EBOO device, where it's continuously ozonated and oxygenated, comes back to me. You can see the increase in the brightness and the beautiful color of that blood as it's going back into me. So the benefits of ozone, well, I guess first of all, what is ozone? Ozone's O3. So oxygen, of course, is O2. Ozone's O3. And so what that means is that ozone is actually a pretty unstable molecule. And so when we put it into the blood or into the body, it dissociates really rapidly and creates a really high oxygenation response. It works in and creates oxidation similar to high dose vitamin C. So the benefits of ozone, again, it creates oxidation, improves blood flow, reduces inflammation, and has antiviral, antibacterial, antiparasitic effects as well. And so this is a really great therapy. EBOO, optimally, I would love to see our cancer clients doing that about once a month. And then incorporating some of the other ozone therapy about once a week. Okay. And again, this would have to be individualized for you. Potential benefits of ozone therapy. So again, as I said, works as a pro-oxidant, forms peroxide, which is very similar to what, in a way in which vitamin C, methylene blue work. They're very synergistic. It's quite safe, has a complication rate of only about 0.006%. It helps create immune system balance, and it oxygenates the blood directly, which helps to counteract the low oxygen environment that cancers thrive in, and has potential direct cytotoxic or killing effects on cells as well. It improves detoxification, improves circulation, and improves mitochondrial function. So mitochondria are those energy packs in our cells, so providing more energy. So PEMF, pulsed electromagnetic field therapy. I love utilizing this in the practice. It's another way of just supercharging the body. So it enhances recovery processes, reduces inflammation, improves athletic performance, improves PTSD recovery. But it also has been shown to reduce pain, inflammation, blood flow, improve bone health, improve sleep, and has potential anti-tumor effects. So the book that I mentioned earlier, by Dr. Pollack, encourage you to check that out, because there's some really cool benefits of PEMF therapy, and you can actually look at getting a PEMF mat for yourself at home. But I do recommend that people, when they come in for IVs of all types, that they do PEMF beforehand, because it improves circulation, and frankly, you're going to get better results with the IVs that you're doing. HOCATT. So this is shall I say, a detox super performer. Okay, so HOCATT stands for hyperthermic ozone and carbonic acid transdermal technology. So this is a steam sauna that heats up to a comfortable temperature, It infuses carbonic acid and infuses then ozone gas in there. And then there's PEMF, there is light therapy, we can put essential oils in there. And then there's also frequency specific microcurrent that we can utilize that's specific to cancer as well. And so we will oftentimes utilize this alongside the other therapies that we're doing to help with detoxification, optimizing the body's function, optimal frequency of therapy for this. Ideally twice a week, but oftentimes once a week is a great frequency for doing this therapy. So what do you do? Honestly, this is dependent a little bit on each individual person. And that's where I like to sit down with my clients or I encourage them to go visit one of those other providers that we talked about at the beginning of this presentation and talk about what are your goals and what are you hoping to get out of the things that we're doing, so that way we can help you to ideally reach the goals that you have. Are you going to be utilizing conventional medicine and you want to utilize these things to help to reduce your side effect profile and be able to make those things work better? If you have an oncologist that wants to work with us, love to do that. Are you hoping to utilize the therapies that we have to offer to be able to beat cancer on its own? Cleaning up your diet and being able to go through a detox program and be able to hit these therapies at a optimal frequency. We can help kind of walk you through that. But I do recommend that we have data. I recommend that we do a full blood panel that first time that we come in, really see where we're at with our blood sugar balance, our inflammation markers, your iron levels, hormones are important. And then also thinking about, again, what I mentioned before, as far as the zinc levels, vitamin D, those types of things are really, really super important. And like I mentioned earlier, the vitamin C needs to be completed at a frequency that's high enough for it to exert its anti-cancer effects. So if we don't do enough, frankly, we're not going to be getting the benefits that we're looking at. Is it still going to be good for you? Yes. It's always, I would argue that it's always good for you. But there's certain times and there's thresholds where we're just not getting the effect that we're looking for. Okay. Now, what if you're in remission? So we're going to talk about screening options here in just a minute. I know this is getting a little bit long, but there was so much information here that I wanted to get through. And so I'll kind of get through this here. But if you're in remission, I think that it's still worth pursuing, looking at toxins, looking at oral health, looking at your gut health, seeing where things are at, so that way we can help to detox and keep you in a state of remission. But there's also a screening option that we'll talk about here in a minute. It's also important that we uncover potential root causes of cancer. And so what are some of those? In my opinion, I think dental health, as we talked about several times, is really, really, really important. One of the things that you can do is you can do a cone beam CT scan, which will help to uncover potential chronic hidden infections, especially around root canals. A GI map, working through parasite protocols. So a GI map is a stool test where we look at the balance of bacteria in the gut. A toxin panel, looking at molds, heavy metals, parasites, herbicides, pesticides, and then mental health. We talked about that earlier too. So I think it's important to verify and monitor remission as well with regular screening. So if you think about it, it's really unfortunate that there's only 5 cancers that really have recommended screening tests: breast cancer, colon cancer, lung, prostate, and cervical. So recently, I've been doing some research and started visiting with a company called Cancer Check Labs. And what they have to offer, I think, is really, really amazing. Now, looking at this screen right here, these are all types of cancer that don't have a current routine screening test. That's kind of scary, you know? I mean, so we're checking a few, but there's a lot that we're not checking, right? So how do we detect these things quicker, detect them sooner? So how does Cancer Check work, or why does it work? So what it does is, so it's just a blood draw test. And what it's doing is it's looking for tumor cells that are circulating through your bloodstream, because tumors dump these cells into your body all day, every day. So these circulating tumor cells spread cancer throughout your body. So Cancer Check can detect these circulating tumor cells in your blood sample. They have a pathologist that visually inspects the captured cells, and they can see this from all 200 plus types of tumor cells. Okay. This test does not work for blood cancers. It's only for tumor cancers, which are the majority of cancers. The rest of the blood cancers, you should be able to pick up on a blood test. Okay. So there's other cancer screening. There's other cancer screening tests that are out there. So what's the difference and why is this better? Well, a circulating tumor cell and how Cancer Check Lab works is they are actually capturing that entire cell, and the pathologist is looking at it. Whereas other ctDNA tests, such as Grail Gallery and Cologuard, what they're doing is they're looking for a very small scrap of a genome and being able to say that there's a potential cancer. Okay, so the problem with this is it has a high false positive and a high false negative rate as well. So the way that this was explained, it's like trying to identify a car by looking at the tires. So yes, is there a car there? But what size? How big? Is it really is it really there? Well, maybe the tire's just laying in the side of the lot, and there's no actual car there, right? And so this test, what it's doing is it's picking up that entire cell. Now, it does not tell us what type of cancer that comes from, but it does tell us that we need to do more digging to be able to figure out what type, so that we can figure out what type of cancer is there. And it can also detect cancers down to stage 0, whereas the other screening tests do not do that very well. And MRIs is another way of potentially screening for tumors. However, it can't detect it at the cellular level, whereas this CTC test can through Cancer Check. So it's a blood test that we do here in the office. And if somebody wanted to do it as an annual screening, even if they don't have cancer, if you wanted to do it to verify remission a couple times a year, we certainly can do that as well. Okay. So other potential benefits of this type of screening is that it has potentially pre-symptomatic cancer detection. It's an additional cancer screening tool. It's minimally invasive. All we're doing is a blood draw, and there's no major side effects, no anesthesia, no surgical cutting, no radiation. So potentially, could this be more beneficial than doing colonoscopies, mammograms and those kinds of things? I think it could be. All right. Next steps. Thank you for putting up with me. I know this has been a long presentation. I appreciate you being here, sticking through this with me. I hope that this has been helpful and beneficial. Please feel free to drop any potential questions that you have in the Q&A for me, so we can answer those for you quick here before we end today. But next steps, if you want to know more about getting started with us, I encourage you to give us a call. Our phone number is right there, 701-532-1926. What you're going to do is request your case review appointment. That's an hour-long appointment where we sit down together, review your case, discuss options, discuss next steps, and what is potentially right for you. For more information on the different modalities that we just discussed, I encourage you to check out our website, valleyvitalmedicine.com. We've got a lot of information there on PEMF therapy, on vitamin C IVs, the other IV therapies that we have to offer, PEMF. And also encourage you to follow us on Facebook, Instagram, YouTube, all that kind of stuff. I'm working on uploading and adding more information there on a regular basis. What questions do you have for me? How can I be of more help to you today? Also, if you have any other feedback or anything for me, Would love to hear that from you too. Please open up that Q&A box on the bottom of the screen, and would love to see if there's anything else that I can do to be of service or to be of help to you today. This topic is really important to me. You see people struggle. We see people with just feeling like they don't have any hope. They feel like there's nothing that they can do in addition to what the doctors are being told should be done to them instead of with them, right? When it comes down to being treated with surgery, radiation, chemotherapy. Am I saying those things are wrong? Not necessarily. I think there's a time and a place, and I think we can be grateful for the tools that are available to us. And frankly, you know what? I encourage each client to really just pray about their current situation, what's right for them, come to a peace about what they want to do to support their body, and be able to, and also fight, and fight for their health, fight for their family. So I think that's really important. It's a hard thing. And we're seeing, I think, an epidemic of worsening of these conditions. We're seeing more cancers. We're seeing more aggressive cancers. And frankly, we all need to work on our the toxins that we're exposed to. And so that's part of what we do here. We actually evaluate toxin levels and to see where you're at and help to determine what we need to work on, help put together a plan of action to actually address the specific concerns that we're finding in your body. So that way we can help your body live at its absolute best for as long as possible. So that our goal here really is to help you be able to live out your God-given purpose on earth in the best way that it possibly can. And so that's our goal. That's our mission here. I'm not seeing any questions in the Q&A. I'll give you guys maybe just a couple more minutes. But again, thank you so much for being here. Oh, sorry. Knocked over my microphone. Yeah, I look forward to visiting with you soon. If there's anything that we can do for you, please feel free to reach out. If you want to just work on some things to help optimize your health, you want to get some lab work done, you're interested in the cancer check lab test, we'd be happy to help you out with that as well. Please feel free to reach out with any questions, concerns. The ladies at the front desk are absolutely amazing, and they'll make sure that we get you set up in the right way. So, all right. Well, thank you so much for being here with me today. Have a blessed day, and thank you for your support, and look forward to seeing you soon. Thank you.